Hello, everyone, and thank you for your interest in the presentation on the plan benefits. I encourage you to familiarize yourself with the benefits and programs available to you and your employees through the local government health insurance board. In order to have a better understanding of our benefits, we think it's important to briefly explain how our benefits work. This slide is meant to give a quick walkthrough as to how our plan and our board operate. Our board administers our health insurance plan. The board meets annually to determine the premiums and benefits for the following year. The board also sets policies, negotiates contracts, and handles appeals that either units or members may submit. Our covered members utilize their benefits when they visit their providers to receive medical care. Usually, their portion of the medical care is to cover their copays, coinsurance, and deductibles. Providers include the doctors, hospitals, dentists, and pharmacies. When the employees visit the providers then send the claim information to the claims administrator, either Blue Cross and Blue Shield of Alabama for the health and dental benefits for active employees and non-Medicare retirees, and Optum Rx for the prescription drug benefits. Once the insurance company receives it, they pass the claims through their incredible discount network and send us the final claim to be paid. The local government health insurance plan has a robust benefit package to meet your needs through every stage of life. It encompasses medical, hospital, pharmacy, mental health, preventative services, and more, along with a vast network of providers to serve you. The plan has a low annual deductible of $200 that combines medical and pharmacy cost. Blue Cross and Blue Shield of Alabama manages our medical benefits, while our pharmacy benefits are managed by Optum Rx. The following scenarios of how benefits may be applied are only for example purposes. For additional detailed information, please refer to the LGHIP plan book located on our website. As I mentioned before, the local government health insurance plan has benefits to meet your needs through all stages of life. Let's start with an example of network benefits commonly used by healthy young adults. Teladoc is a free service for members of the local government health insurance plan that provides consultations with board-certified doctors via phone or video 24/7. Members can speak with a doctor about a variety of issues, such as allergies, infections, rashes, and more. When necessary, the doctor can even prescribe medication. This benefit can be used in place of the emergency room or urgent care clinic for non-emergency situations. This saves you time and money. Download the Teladoc app, visit their website, or call Teladoc to begin using this valuable benefit today. Preventative visits are covered at 100%. This includes services such as cancer screenings, annual physicals, and immunizations. Outpatient mental health as well as substance abuse services are available for $14 per visit for up to 20 visits per year. Office visits are subject to a copay. Visits to a nurse practitioner, physician assistant, or DO are $20 per visit. A physician is $40 per visit, and a specialist is now $50 per visit. Pregnancy and motherhood can be a stressful time, but you don't have to worry about your health care coverage, especially when you enroll in the Baby Yourself program through Blue Cross and Blue Shield. This is a free program, and it's valuable. Enroll in this program before the end of your second trimester to take advantage of support services, educational consultations with a nurse, free gifts, and to have your hospital and provider copays and deductibles waived. Once your bundle of joy has arrived, you can rest assured that the many immunizations and routine well baby visits are covered at 100% when using a network provider. Allergy testing and treatment is covered at 80% and subject to the calendar year deductible. ABA therapy for children on the autism spectrum is subject to a $14 copay when performed by a network provider. But please note that a pre-certification is required prior to receiving this therapy. Should you have an unexpected event take place, whether an auto accident or your child falls off a skateboard, the local government health insurance plan has benefits to meet your needs. Ambulance services are covered at 80% and are subject to the calendar year deductible. Emergency room services are covered at 100% when provided within 72 hours of the accident. Diagnostic x-rays and surgery are both covered at 100% and are subject to a $100 facility copay. Physical therapy network benefits are covered at 80% and they are also subject to the calendar year deductible. Continuing with examples from different stages of life, aging adults with chronic conditions may utilize these benefits. Inpatient hospital admissions are subject to a $200 admission deductible on the first day, $50 facility copay for days 2 through 5. Medical emergencies not related to an accidental injury have a $200 facility copay. Lab test will be $7.50 copay per test. Dialysis, chemotherapy, radiation, or infusion services are subject to a $25 facility copay. Durable medical equipment is covered at 80% and is subject to the calendar year deductible. Should you require home health, it's covered at 80%, subject to the calendar year deductible as well, but please note that pre-certification is required. Now let's review the prescription drug benefits available through the local government health insurance plan. Our medications are assigned to different tiers. Tier 1 being the preferred generic drugs. This is the most common tier. These drugs will process at a maximum of a $15 copay in 2021. Generic maintenance drugs may be dispensed for up to a 60-day supply after an initial 30-day fill. Tier 2 medications, these are our preferred brand drugs. These are covered at 80%, subject to the $200 calendar year deductible. Member pays the cost of the drug at the pharmacy and then submits for reimbursement through Optum Rx. These medications may be dispensed for up to a 90-day supply. There is a $200 annual deductible, but remember, this can be a combination of medical and pharmacy cost. For prescriptions to count toward the deductible, you must submit for reimbursement through Optum Rx. Let's talk more about how to do that. Brand name formulary medications for drugs in Tier 2 and 3, along with specialty medications, may be eligible for reimbursement. Create or log into your Optum Rx user account and submit the reimbursement request electronically. Or you can print out a copy of the reimbursement form and submit by mail. Reimbursement checks will be mailed to the card holder's address on file. Please allow adequate time for processing. We are working on improving this process by shortening the turnaround time. Please be on the lookout for upcoming updates. Let's talk more about the tiers. Tier 3 drugs are set up similar to Tier 2. They are covered at 80%, subject to the $200 calendar year deductible. Again, the member pays the cost of the drug and submits for reimbursement through Optum, and they may be dispensed for up to a 90-day supply. Tier 4 drugs are high-cost, life-sustaining medications. These medications have been pre-approved to process at the 20% member responsibility at the pharmacy. These medications are not eligible for reimbursement. Specialty drugs. Like Tier 2 and Tier 3 drugs, they are covered at 80% after reimbursement and also subject to the annual deductible. Many specialty medications must be filled at Optum Specialty Pharmacy, and there is a 30-day supply max on these medications. There are a few important things that you need to be aware of. The list of covered drugs, or formulary, is available on our website. A prior authorization is required for coverage of drugs that are not listed on this formulary. There are no benefits available for drugs that are obtained at non-participating pharmacies. Many specialty drugs may only be dispensed by calling Optum Specialty Pharmacy. Mail-order drug benefits only apply to specialty drugs. For units that have elected to provide dental coverage through Blue Cross and Blue Shield of Alabama, these benefits apply to you. There is a $25 annual deductible per member with a maximum of 3 deductibles per family. Diagnostic and preventative services are covered at 100% with no deductible. This would be your twice yearly cleaning visit. Basic and major services are covered at 50%, subject to the $25 deductible. Orthodontic services only apply to dependent children under the age of 19. They are covered at 50%, subject to the deductible, and they are limited to a $1,000 lifetime maximum per person unless deemed medically necessary. There is an annual benefit max for members over the age of 19. If you're under the age of 19, there is no max benefit. See the plan's dental plan book on the local government website for detailed benefit information. In an effort to help our members become healthier and to identify areas where they may be at risk, the local government health insurance board has established the wellness program. Employees and non-Medicare retirees who are enrolled in the plan, along with their covered spouses, are eligible to participate in one wellness screening during the wellness qualifying period. The current wellness qualifying period for the 2022 rate period is August 1st, 2020 through October 31st, 2021. Going forward, the screening dates will be November 1st through October 31st. 80% participation is required for preferred premium rates in 2022. We're excited to offer 2 programs to our eligible members and their spouses. Virta and Naturally Slim are 2 of our health and wellness vendors. Virta is a program that has been proven to reverse type 2 diabetes without surgery or medication. Naturally Slim is a separate program that will help our members get on track to healthier lifestyles. Now let's hear from both vendors.
They told me I'd follow in my mother's footsteps. She died young from diabetes. That terrified me.
I was in constant pain, especially in my feet. I didn't know if I was going to be able to carry on doing my job with the pain that I was suffering from.
I was diagnosed at 27 with diabetes, and shortly after that I was put on insulin. For me, that was scary.
They told me the best way to help my patients was to prescribe more medication. We see their health getting worse. There has to be a better way.
They tell us all these things about what living with diabetes is all about.
What living with diabetes means.
but they're not true.
With the current standard of care, or just managing disease, there's a real solution for this epidemic, and people should know about it.
My job is to provide benefits and save the company money. I now have a life-changing solution for our employees and their families.
I'm not on insulin anymore, and it's a very big deal. Can't wait to see what's next.
I'm better at my job than I was 10 years ago. I don't deal with the constant pain, and I'm putting the young guys to shame.
So now I'm keeping up with my grandsons, and I'm eager to see what life has in store for me. I got teared up.
Now, more than ever, is a great time for public employees in Alabama to invest in their health, both their physical and emotional health, and the local government health insurance plan is making it easy. Over the past 2 years, tens of thousands of public employees have lost weight and dramatically improved their health and quality of life through the Naturally Slim program. And now you too can take advantage of the most effective digital health improvement solution in the country. Naturally Slim will help you lose weight. That's just what happens. But that's also just the beginning. In addition to losing weight and keeping it off without dieting, participants show measurable improvements in metabolic health, physical activity, energy, mood, and overall emotional well-being.
What I like to tell people is that I've done this, losing the weight and getting my life back without having any surgery, no pills, and it's not a diet. It's just a lifestyle change.
The things that I've gained because I'm healthier, because I have more energy, are things like being able to play with my kids, to have energy for my wife. Those intangibles, you don't ever read about those in a weight loss brochure.
Besides an MD, dietitian, and physical activity expert, the Naturally Slim team includes 3 psychologists who will help you build skills to improve your sleep, increase resilience, and lower your stress. And best of all, it's all done through technology, using your phone, tablet, or laptop.
I was skeptical, didn't see how it would work, but once you start watching the videos and learning all the tools to use, yes, it works.
I just got my old self back, really. Just listening to my body, it was so easy.
It totally changed my perception of how I saw food.
Not just about the food and the eating, it's about taking care of myself, and that's been a huge, huge change for me.
I have more energy, more confidence, less pain every day when you get up. You feel better, and you just can't put a price on that.
With what's going on now with the pandemic, then this could have been a time I easily could have crashed and burned and went back to my old eating habits.
You might not know if it'll work, but you don't know that it won't. So, you have to just give it a try. And once you give it a try, then you'll see the results for yourself.
I think that no matter who you are, no matter where you are, no matter how much hope you have lost in this battle, try this one more thing. It will be the last thing you have to do.
Your journey to improved health can begin soon. Naturally Slim is offered at no charge to all subscribers and spouses enrolled in the local government health insurance plan administered by Blue Cross Blue Shield of Alabama. To sign up or learn more, simply visit naturallyslim.com/LGHIP.
Thank you for listening today. I hope that you have found this information helpful. I also hope that you have a better understanding of the plan's benefits and programs and how you can apply them to yourself and to your employees. Feel free to contact me if I can ever be of assistance. Thank you again.